Good morning everyone. Let's start with a new topic, that is disability evaluation. Contents will be definition, introduction, principle of disability assessment, guidelines for evaluation. Components will be doing in the next session. Okay. So definition. When we are talking about or dealing about disability, we need to know important three things, that is impairment, disability and handicap. Impairment is nothing but loss of abnormality of psychological, psychological, physiological or anatomical structure. Impairment is nothing but loss or abnormal. Disability is nothing but any restriction or lack of ability to perform any activity of daily life. Handicap is the disadvantage. Handicap is the disadvantage occurred due to permanent disability. Okay. So I hope you understood. Impairment is nothing but loss or abnormality in psychological, physiological and anatomical structure or function. Disability is nothing but restriction or lack of ability to perform any activity due to impairment, and handicap is nothing but permanent disability. That is the disadvantage given to the subject that limits the or prevents the fulfillment of doing a function. The universal guidelines for the assessment and certification of the following disability were finalized by a group expert. There's a group expert who is going to identify a person with disability and give him a certificate. This were notified these group expert, and this is going to get notified by Ministry of Social Justice and Empowerment. Now, what are the kinds of guidelines which they follow, wherein they look into that aspect? First one, visual impairment. How good his eyes are working, how far he can see, how near he can see. This is very important. Far and near vision is also very important when you are selecting for army, air force or police, etc. Locomotor disability, definitely it is important in many of the occupation. Speech and hearing, it's also important in intellectual as well. Mental retardation, again coming back to the intellectual, and multiple disability, not only one. Any RTA patient who has undergone so many hip surgeries and knee surgeries with permanent disability, then he is going to get multiple disability certificate. According to PWD Act, that is person with disability empowered persons, this PWD is going to empower person to give disability certificate will be a medical board, by a medical board. This medical board consists of 3 members, out of which at least one shall be a specialist in the particular field. Now, what are the particular field of assessing? Locomotor, visual, hearing and speech, mental retardation. These are the same thing where we learnt about these 5 things what we learned, where in the disability guidelines, universal guidelines to follow for assessment of disability. Sorry. So at least one should be specialized in these particular field, duly constituted by central and state government. When we are learning about impairment, disability and handicap, there is one more term known as functional limitation. That is, the impairment may cause functional limitation, which are the partial or total inability to perform those activities necessary for motor, sensory or mental function. So please remember the term functional impairment. Functional impairment in physiotherapy is very important because we deal with the function, we deal with the locomotion, we deal with the movement. So every time a physiotherapist is going to treat a patient, he has to first approach towards his, definitely first his pain and range of motion. Main goal should be his functions. The patient has come to us with some pain during that particular function which is hampering his daily activity. So physiotherapist should have the main goal to improve his function, to reduce the pain in that function, not static, not dynamic. In that particular function we need to reduce the pain. That must be the ultimate goal of each and every physiotherapist. Thus functional limitation, sorry, it is not impairment, it is limitation, is very important. Impairment may cause functional limitation which are partial or total. partial or total inability to perform those activities necessary for motor, sensory and mental function. So this is nothing but functional limitation. Now we know the certificate is given by the medical board, which has it should consist of 3 members, which among which one should be at least specialized in that particular field. Let it be visual, hearing, speech, mental, locomotion or whatever. So how they are going to decide that this person is going to get the disability certificate? There are percentage of that. Eligible percentage to achieve to receive a disability certificate minimum should be 40% in order to be eligible to term them as disability in the area of blindness, leprosy, cured hearing, locomotor or mental retardation. Now how to evaluate? Last point is how to evaluate. Evaluation of permanent physical impairment. Now what is permanent physical impairment? We understood what is impairment. So let's recall what is impairment. Impairment is nothing but loss or abnormality of psychological, physiological or anatomical structure or function. This being permanent will lead to restriction in the functional activity or daily activity, that is termed as disability. So permanent physical impairment, how to evaluate it? Whichever the impairment is physical and it is permanent is known as permanent physical impairment. What are the things to evaluate in that is upper limb, lower limb, trunk, amputation, neurological condition, facial injuries such as burns, neck, trunk and genitalia burns, cardiopulmonary diseases. This is based on the aspect of physiotherapy. So if you are learning about physiotherapy, this video is very good. Broad principles of disability assessment. Now these are the broad principles. Functional loss, as I already been explaining that we are physiotherapists, we need to train the function, not the static or dynamic pain. So first important term to term a patient or a person as disability is functional loss. This is the important principle. Functional loss is nothing but it's the assessment of functional loss or some uniform test resulting from permanent physical impairment caused due to congenital or acquired condition. Functional loss is nothing but functional loss. Definitely that function is lost. Now due to what? Due to the reason for terming a patient to be disabled is nothing but due to permanent physical impairment. The reason is permanent physical impairment to term a patient as disabled. If permanent physical impairment is causing functional loss, definitely the principle of functional loss is positive in that condition. Let it be congenital or acquired condition. Second one, individual functional requirement. Functions are assessed in relation to standard desired functions of the anatomical part. Now, if the person who is supposed to be termed as disabled has undergone entire upper limb amputation from below elbow. So what function is lost? He cannot eat. So elbow flexion, he cannot supinate pronate. So key opening or lock opening and closing is lost. So that is the function. Anatomical what? Supination pronation is lost because elbow below elbow is gone. So there is no radius and ulna moving over each other, thus leading to functional impairment of the supination and pronation. So this is termed as individual function requirement. If that the person is a cobbler or someone wherein supination and pronation is very important, that function is lost. So functions are assessed in relation to standard desired functions of anatomical part, not the anatomical function per se. Now coming to where to decide percentage on extent of function or activity. No loss, partial loss or total loss. Many a times it will be a partial loss, as the modified medical therapy suggests. Least time it is total loss, and no loss can be treated by conservative management alone. No loss where activity can be performed normally without any assistance. Partial loss partly or with partly assistance is needed. Total loss even with assistance the activity cannot be performed. So the next point, the important point coming down to the depth about the today's topic is guidelines for evaluation. There's one particular formula, as you can see, as I have underlined the formula, is A plus B bracket 90 minus A by 90. This is the formula to total up the percentage of disabled a person has to term himself as disability. As we already studied that 40% is minimum to be a person, to get him to eligibility criteria to term him as disabled person, wherein A and B stands for the higher score, A stands for the higher score and B stands for the lower score respectively, and this 90 is nothing but a constant. This formula is used to evaluate PPI, that is your permanent physical impairment. What are the variables in assessing locomotor disability? We being physiotherapists, we need to term functions and locomotion. It is very important. So first we'll learn about locomotor disability. Locomotion, as we term suggests, locomotion, we generally think, layman language, we generally think locomotion is nothing but walking or running. What comes to our brain is nothing but locomotion is restricted for lower extremity. It is not so. Locomotion is also known for upper extremity, because we tend to move our upper extremity upwards, that is forward flexion, abduction, rotation, to do the daily activities. Thus locomotor disability is for both upper extremity as well as lower extremity. When we are talking about that locomotion, it is not only range of motion, it is also strength of muscle, range of motion, coordination, how your extremities move smoothly, accurately to reach a single point, stability, limb length discrepancy, hand functions. As I already told, upper extremity is very important. In hand functions we have prehension, sensation and strength. Along with that, we also need to know sensation, deformity, if any present from congenital or acquired, complications like pain and infection which carry an extra mark when we are grading a person's disability percentage, along with extremity to be dominant or non-dominant. This is also assessed in the lower extremity as well. Thank you. Let's meet you all in the next video.